And we're live. Hi, everyone. Welcome to Talking Live with Macy. I guess I'm going to wait for 15 people to join us before we officially begin. And more importantly, if you're watching this stream, what you should do right now is share this. Share this video so people are more aware about pains that happen in their joints or stiffness that occurs. And do not attribute it to something else, but it could be arthritis. So please stay tuned, join us, share this video as much as possible with your friends, with your family. I think today the counter is a bit slow, so I'll wait for 15 people before we officially begin. And it looks like there are more and more people joining us already. So guys, we need to actually continue to share more information about arthritis. I know there were many people that joined the stream for the first episode on ankylosing spondylitis. And this episode, we're going to talk a lot more about arthritis in general and its various types. So please stay tuned and stay connected. And more importantly, we want all of you to be informed. So please share this video out as much as possible. We are waiting for 15 people to join us before we officially begin. Looks like more and more people are joining us. Hi, Christopher. Hi, James. Hi, Nara. Please share this with your friends and family who are actually having arthritis. And for those who are not, we need to get people aware of it. So it's time for you to share, to be connected, and more importantly, we need to get more people to join us so that they are aware of it as well. So it looks like we have 15 people already. So I'm going to start. Welcome to Talking Live with Macy. I haven't seen many of you in 2 weeks. For the new audience, hi, it's good to see you. For those of you who are always coming back to find out more, which is great, welcome. And now this is a follow-up episode of the first episode on arthritis, which is on ankylosing spondylitis. This episode is on general arthritis, the various types, and how to manage it. I think many of you asked about autoimmune disease previously. And actually, one of the arthritis that will be talked about today is a part of autoimmune disease. Just a PSA before I introduce today's main topic is please stay home, stay safe. Let's try to flatten the curve for COVID-19. We do not want our healthcare professionals and the frontliners to be exhausted and for our health care facility to collapse. So please do your part, stay home, stay safe, practice the SOPs as much as possible. Now, today's topic is about deep diving into arthritis, the various types, and how to manage it. So arthritis in general is swelling and tenderness of one or more of your joints. The main symptoms are joint pain and stiffness, which worsens with age. The most common arthritis is osteoarthritis and rheumatoid arthritis. Rheumatoid arthritis, short for RA, is a chronic, progressive, and disabling autoimmune disease, whereas osteoarthritis is caused by a breakdown of cartilage, a more common arthritis amongst elderly people. Now, many of us, we are always often confused when we have pain. We always head to the acupuncturist, I know, Malaysians, or we just attribute it and take Panadol. But that's not how it works. It could be arthritis or a type of arthritis that you are suffering from. So let's find out more. We have an expert with us today. He is an associate professor at and a rheumatologist at UMMC. We have Associate Professor Fariz, and we also have his patient, an ankylosing spondylitis patient, Mr. JC Lee. Thank you both for joining us today. Of course, for those of you who are watching, tuning in right now, please start asking questions, comment in the comment section so we can pick them up at the end of today's session rather than having a backlog of questions where you're typing in and we cannot pick them up. All right. So once again, please share this with your friends, with your family. Be informed, and we should find out more about what our pain at our joints could be. So I'm just going to jump straight into the questions. Once again, thank you, Prof. Fariz and JC, for joining us.
Thank you for the invitation, JC.
Thank you so much. So I'm going to start off with the first question for today. So, Prof, what are the different types of arthritis?
Okay, thank you very much, Maisie. Before I proceed, I would just like to say thank you again for the kind invitation to the show. I think it's a great opportunity for us to disseminate some more knowledge about arthritis and also share our experience with arthritis. So the different types of arthritis, we always hear about arthritis, and the term arthritis is being loosely used to refer to joint inflammation. But technically, the terms arthritis and rheumatism are also being used to describe about other 200 different conditions which not only affect the joints, but also the tissues and structures that surround the joints, and even other autoimmune connective tissue diseases. So there are many different types of arthritis. Ankylosing spondylitis is a type of arthritis which primarily affects the spine, and I believe JC later on will share his experience about living with this condition. As Maisie mentioned just now, the most common form of arthritis is actually, to us in Malaysia, is osteoarthritis. So how this happens is because in our joints we have bones, and there's this thing called cartilage, which is the hard, slippery tissue that covers the ends of the bones where they form a joint. And osteoarthritis causes this cartilage to break down. So eventually, the bones will start to rub together, and the joints being slightly inflamed, and people will have pain, bone injury, and some even might have some what we call a bone spur formation. Another form of arthritis, which is associated with the skin, which I'd like to highlight here as well, is a skin condition called psoriasis. Up to 30% of patients with psoriasis will also develop psoriatic arthritis. And usually these people will experience the skin condition psoriasis before the psoriatic arthritis sets in. So it's called psoriatic arthritis. It's not actually rheumatoid arthritis. It's a bit different. But in this situation, the fingers are usually most commonly affected, the toes. Patients might have their fingers looking like a sausage-like form, and they might have also nail involvement as well. So this type of arthritis usually happens in people aged about 30 to 50 years, with men and women equally suffer from it. How we diagnose this psoriatic arthritis is usually by a rheumatologist who's aware of that this condition, the subtleties of this disease. And for someone who has psoriasis, there's a chance that he or she could develop psoriatic arthritis. And if that joint symptoms persist in someone who has psoriasis, then he or she might have to see a doctor or rheumatologist as early as possible. The other form of arthritis, which I think it's very important to be aware about, is rheumatoid arthritis. Now, why I think rheumatoid arthritis is important, because it's one of the most common form of inflammatory arthritis in Malaysia. Not just because that, but because there are treatments available for it. And if someone with rheumatoid arthritis doesn't get that condition properly treated, he or she might suffer from joint damage, and this joint damage might be permanent. So rheumatoid arthritis is an inflammatory arthritis related to inflammation, and these people who suffer from this condition may suffer from pain, they might have joint swelling, they might be unable to do their daily activities, they can't even open a bottle, for example, they might suffer from maybe a slight amount of depression, and they will have what we call a poor quality of life. Other common rheumatic conditions or arthritis could also be related to autoimmune conditions like lupus or SLE. And another form of arthritis is also commonly we see in Malaysia is gout. So gout is also a form of arthritis. We do see a lot of gouts. And most of these arthritis, the inflammatory arthritis or autoimmune arthritis, can actually affect multiple organs and also cause widespread symptoms. So it's important that we are aware that the different forms of arthritis exist, whether they are inflammation related or non-inflammation related, such as osteoarthritis. So I think that's fairly important to know.
Wow, I'm actually surprised. I didn't know that gout was actually a form of arthritis. And that's actually good to know. And also, I actually have a friend who has RA. So she was the one that told me that it's connected to autoimmune diseases. So it's good that all of us are aware through today's talk. And if you have friends who have gout, who have RA, or any type of arthritis that Prof. Fariz mentioned, please share this with them today and get them to join today's stream to ask questions. Thanks a lot, Professor, for answering my question. My next question, actually, for you is many people think that only seniors actually get arthritis, but is that true?
That's not quite exactly true, because arthritis can affect any age. The arthritis that we think of when it affects when we are seniors is the arthritis. It's called osteoarthritis. So it's a non-inflammatory arthritis. That's quite more common in the senior population. So it's a degenerative condition. As I mentioned earlier, the joints start to rub against each other, a very minimal amount of inflammation. More or less, it's related to degenerative condition of the joints. And usually what we see as people grow older, they tend to have a higher risk to develop it. But it doesn't mean that when they get old, they will have osteoarthritis. It's just that they might have a higher risk to develop it. Osteoarthritis can also be increased, or we can also see osteoarthritis in other conditions, such as maybe athletes, maybe they have sports injuries, chronic sports injuries, they might have overuse of joints, people who have genetic factors or obesity might be at a higher risk, and people who have a family history might have a higher risk of developing this osteoarthritis. So it's not, that is more with the osteoarthritis which affect the senior population. So in technical terms, arthritis itself, it can affect any age. So it can affect including young children. It can also affect people who are in their 90s. And it's important that this category of joint inflammation not only affects the younger adults, children, and elderly population. This is rheumatoid arthritis, and it can just happen in anyone of any age. And during my training many years ago, I've even seen children as young as 3, 4, and 5 years old being affected with inflammatory arthritis. We don't call it rheumatoid arthritis, it's more or less something similar with inflammatory arthritis. And throughout our practice as well, I've also seen patients who are in their 70s and 80s being affected with rheumatoid arthritis. The thing is with rheumatoid arthritis, although it can affect any age, it does. It is a bit more common in the young, in the adults age between 30s, 40s, and 50s. That's the more common age duration that patients develop rheumatoid arthritis. And women are a bit more likely to develop, probably about 3 times more likely to develop rheumatoid arthritis than men. So, as long as many years have passed by, and even until now, how the different types of arthritis affect the people of different age hasn't really much changed. But it's important to be aware that any form of arthritis can present in any age. It's just the inflammation form of arthritis is very important to identify. Um, because there are treatments available, and we don't want these patients to suffer. We don't want their joints to be damaged in the long run.
That's very, very true. I think the most important is to detect it early, be it whether it's osteoarthritis, rheumatoid arthritis, since it can also happen to children, and also whether it's gout or psoriatic arthritis. These are the various types that Prof has mentioned. So please take note of this and be more aware. So talking about patients, I have a question for you, JC, who is an ankylosing spondylitis patient. So tell us how you first detected that you had AS.
Okay, Maisie. So for my case, right, my diagnosis was actually an incidental finding. In fact, I actually already have some symptoms before that, but I didn't know that it's ankylosing spondylitis. I went for a regular checkup, and the doctor actually found my inflammatory markers a little bit higher than normal, namely the ESR and HSCRP. So I was asked to repeat the test 3 months later, which I did, and the readings were still quite high. And only then I was referred to a rheumatologist. From there, I actually got my sacroiliac joint, which is the pelvic bone, scan, as well as some questions and some measurements done by the rheumatologist. And so that actually confirmed that I have ankylosing spondylitis. And further confirmation was done with Prof. Fariz at the UMMC with a blood test called HLA-B27. So that's when we started managing AS in a more proper form, basically.
I see. So that's how you first
Mm,
detected AS through a
mm,
blood test.
correct.
Okay, very interesting to note that at least we know blood tests can help us with that. Now, back to Professor, what are the most common arthritis that you see here in Malaysia?
The common arthritis in Malaysia, we don't have much data, but if we look at the United States, for example, and they have this CDC, or the Centers for Disease Control and Prevention, they managed to find out about over 50 million adults have at least some form of arthritis. And out of these
Wow.
50 million adults, about 20 million actually had their arthritis affected their daily lives in some way. So whether this could still be osteoarthritis, but the American Arthritis Foundation estimates that about 1.5 million adults in the US actually have rheumatoid arthritis. Now, in Malaysia, we don't have a lot of data or prevalence about how many rheumatoid arthritis is there, but we estimate there might be about 5 in 1,000 people might have rheumatoid arthritis or is affected by rheumatoid arthritis. Now, although we know that the most common arthritis is osteoarthritis, um, but then the osteoarthritis is the most common form of arthritis, when rheumatoid arthritis is the most common form of inflammatory arthritis in Malaysia. So, um, if we look at the different aspects, these two might uh, be looked at different way,
Correlate.
how we say how common it is. Gout, we also see a lot of patients who have gout, and it's also quite common in Malaysia. So we don't know whether gout itself, whether there might be some genetic links perhaps with the population. In New Zealand, for example, Maoris have high incidence of gout. So whether some genetic factors might be involved, but there's also this, our diet and our lifestyle. The prevalence of gout seems to be quite high in Malaysia as well. And we talk about other common arthritis, ankylosing spondylitis. Now, this is a condition which really have my interest, and I think JC, sharing his experience is something that maybe we are still underdiagnosing our patients with ankylosing spondylitis. People with back pain maybe thinking it's probably not going to affect them that much, but it would be really useful for us to actually diagnose people with ankylosing spondylitis earlier. We can provide them with better care and better treatment. So I don't really know how common ankylosing spondylitis in Malaysia is, but we hopefully more data, more research will come out in the future, and then we'll have our numbers, and then we can actually target based on the common arthritis population that we have, and possibly do the right thing with all of these patients.
That's true. I think the most important is to get diagnosed early and also to detect it. I see that some of you have gout. My husband Ben also has gout. So I didn't know it was a form of arthritis, but I know that it's pretty common here in Malaysia. So the next thing is, when when are the early signs, for example, for rheumatoid arthritis? Since it's so common in the States, we assume also that it's quite common in Malaysia. So when are the early signs for rheumatoid arthritis? What should people take note of?
Well, rheumatoid arthritis can present it doesn't present the same way in everyone, but most of the typical presentation is that people will have their joints being swollen. They have their joint inflammation. They suffer from pain. They suffer from aches, the joint stiffness, either in one joint or usually is more involving a number of joints. And these symptoms with patients with rheumatoid arthritis, they can either develop gradually or maybe suddenly. There's no specific duration, although we see a lot of patients with rheumatoid arthritis, slightly more of them are actually females in the 30s, 40s, 50s. However, we don't really exclude people who are outside of that age group, whether they're males. We also see rheumatoid arthritis in males, so we can't really exclude patients who have joint inflammation not having rheumatoid arthritis. So it could happen in anyone. In rheumatoid arthritis, what actually happens is that in our joints, we have the lining of the joint, and this is called synovium. In rheumatoid arthritis, this synovium, it becomes inflamed. So when it becomes inflamed, if someone who has inflammation will get it, painful, red, swelling, it's going to hurt with that inflammation. So this swelling is usually caused by that synovial fluid production. So that lining actually causes fluid, but it's actually inflamed synovium. So there's inflammation happening. So people will have pain of that joint caused by possibly some small nerve endings around the joint, or even the chemicals produced by the inflammation, and also even that joint capsule being stretched by the swelling of the joint. And usually when this inflammation of the joint happens, people will usually feel that the joints are red and warm because of the increased blood flow of that inflamed joint. And the typical symptoms of rheumatoid arthritis, I don't know whether your friend has spoken to you about it before, but most of them will have that early morning joint stiffness. So when they wake up in the morning, they find it really difficult to move their hands, their fingers. They can't even hold their toothbrush correctly until maybe about 1 or 2 hours when they go to work. Then the joints start to loosen up. And it usually happens in both sides, the left and right hands, equally. Now, this might develop not overnight, but usually takes several weeks. And some of our patients or patients with rheumatoid arthritis also will have they find that their joints swelling are fairly noticeable. You can see their own fingers being swollen up, and they can have significant tightness with that joint pain. And then people who have this joint deformity later on, they can have that joint deformity if that condition remains untreated. So, however, some other people with rheumatoid arthritis can also have other organs involved, including the heart, the lungs, the eyes, and sometimes even the skin. And it's also important that rheumatoid arthritis doesn't just appear by itself. People with rheumatoid arthritis can also have diabetes, hypertension, other medical conditions, and so it's quite important that we also take these into consideration as well. So, so technically, rheumatoid arthritis can really, affect someone's ability to perform their everyday tasks and their quality of life. So,
Wow, I didn't know it was so severe, and I think a lot of people also would like to know, because a lot of people have conditions related to their autoimmune. So how is rheumatoid arthritis connected to the autoimmune system?
well, Maisie, no one really knows exactly. They're not exactly sure what causes rheumatoid arthritis. Obviously, there is some relationship. It is an autoimmune disease. There is some autoimmune process. Um, so, speaking in a general, simplified way, we believe that the immune system can actually become confused. So, generally, the body tends to protect itself. So when the immune system becomes confused after a virus or a bacterial attack, um, it's going to trigger some chemical process in the body, and this is more or less is involved with the immune system dysfunction, and it involves inflammation. So our body normally produces inflammation to destroy these viruses and bacteria, which causes the illness. Now, it's more or less something, a similar concept in rheumatoid arthritis. We don't know what sets off that inflammation of the joints with rheumatoid arthritis. There are theories that it might be associated with or triggered by maybe some viral infection, perhaps, whether the environment plays a factor, genetic itself might play a factor. So when this happens, all the cells will start to attack their own joints, and that joints will become destroyed. So unfortunately, in rheumatoid arthritis, it's our own tissues in the joints which are being attacked, and it can actually cause that damage to the cartilage, to the bones, and also the ligaments around the joints. Having said that, as an autoimmune diseases, there are blood tests which we can actually use to help diagnose and detect this condition as well. These are called blood tests called rheumatoid factor, and also an antibody test called NT-CCP. CCP stands for citrullinated C peptide. And people can do it just by a simple blood test. They can just do, if they have access to the doctors, they might be able to do it. But I would only suggest do it if you have symptoms suggestive of rheumatoid arthritis. Because if you do these blood tests and you're perfectly very well, it's just going to be add to confusion, because they're very, very small percentage of people who are significantly very well might have that rheumatoid factor or NTCC blood test being positive, but they are still not, shouldn't be diagnosed as rheumatoid arthritis. We also use blood tests to detect that inflammation level in the body. JC mentioned just now ESR and the C-reactive protein, or the CRP. These are fairly relevant and very useful blood tests to us, because it can actually detect inflammation in the body. And when there is inflammation, we need to bring down that inflammation. We usually, what we do is just monitor these blood tests every so frequently, just making sure that the inflammation is being well controlled.
Manage.
Because
Okay.
inflammations have set in, yeah, and then all the joints have been damaged. The joints are not very good at healing, actually.
Oh, wow. So it's good that JC actually detected it earlier then.
Yes.
Thanks.
It's a good thing you had that check, JC. So even though you had mild symptoms, I think it's a very useful test if we really suspect something. And it really paid off, I presume, having that test done.
Yep,
Thanks,
definitely.
Professor, for answering all of my questions. So, guys, those of you who are tuning in right now, besides sharing this, please ask your questions so Prof can take it up after this. I have two last questions now for JC. So, JC, how have you been able to cope with ankylosing spondylitis?
Actually, Maisie, I'm one of the more fortunate ones. I'm coping quite well. I mean, in comparison to some of the other peer patients that I know, I'm actually getting a lot of medical attention from Prof. Fariz as well. So I basically go for my periodic blood check. I get to see Prof to do an assessment for me from time to time to make sure that I'm still doing okay. I'm generally quite able. I'm not so tied down by all um, the problems related to AS. So, but my aim right now is to stay as fit as I can, stay as healthy as I can, to always monitor the inflammatory activities, the AS activities that happens to me. So basically, I do a lot of stretching, I do a lot of exercises. I also get some medical care from the pain clinic over at UMMC, Prof. Anwar, and then also some sports and exercises from the sports clinic from Dr. Azwan and Prof. Naha. So there are a lot of things that I have to learn from these medical professionals, the doctors. And there's one thing about AS is that motion is our lotion. So the more we move, the more motion we do, it keeps us more flexible, and then it tends to slows down the degeneration of our joints and to reduce the AS activities altogether. So exercising is very important also. So that's generally how I manage my AS here.
So it's good that you actually have a team of doctors to help you with your AS. Since you actually go for you actually have physiotherapy, stretches, and stuff like that, right?
Yes, correct, correct,
Wow.
correct.
I think that's very important that we are able to manage it well. And like you said, it doesn't progress worsen further. So, what was one of the most difficult moments living with AS, since you're actually managing it well now?
Well, Maisie, to be honest, it's very difficult to pinpoint any one most difficult moment because every day presents to you a new challenge. Every now and then there will be new pain from in different areas of your body that is new to you, you know. And but I think all in all, the for me personally, it's about that sense of uncertainty. Because we are dealing with autoimmune, and like Prof said, there are so many factors that can cause the inflammatory response in our body, and we will never know. Sometimes I struggle a lot with uveitis, which is the inflammation of my iris, right? So it's also part of AS to be affected. And then sometimes when you wake up, my eyes will be swollen, and all these uncertainties will sometimes throw me off my scheduled work or my appointments, my especially when it's work related. So that's the most difficult part, the uncertainty of it. So, but slowly, bit by bit, as we progress and with good medical care, with good medical advisors from Prof and the other doctors, I've learned to manage symptoms, and I've learned to manage those the things that happens to me. I can respond slowly, bit by bit, right? I learn through the process, but uh, at the end of it is that uncertainty, and also physically there will definitely be a lot of pain involved. Every period. I mean, it's not every day, but when it happens, sometimes it could be very painful, and then uh, you do not know how long it will stay. Sometimes it will stay on for a couple of days. Sometimes it could just go off within a day, you know, things like this. So yeah, so generally, but for me, I'm still coping very well lah. Thanks to all the advice that I'm getting.
I'm glad that you found a great team of doctors to help you,
Yeah.
JC. And thank you so much for your sharing with us, for actually the AS community who's tuning in right now. And we're about to open it to everyone to ask your questions. I know all of you are already putting in your questions, so I don't want to delay that further. Prof. Faris wants to show you guys some pictures of, I guess, how inflammation looks like. So I'll let him do that before we take questions.
Thanks very much, Maisie. So I only have a few pictures, but I think it's quite important for everyone to understand inflammation, especially with rheumatoid arthritis and inflammation arthritis. So this picture shows someone with an inflamed joint. You can see that his left thumb and his right thumb is completely different. So and you can actually significantly see whether someone has inflammation of the joints by just comparing one side or the other. This is a condition called psoriasis. It happens in the skin. It can also affect the joints, and it's very rough, scaly, silvery scale lesion. If you have some queries about it, if you have some skin lesions you're not sure of, please see our colleagues, the dermatologists, the skin specialists. They're very good in helping to confirm the diagnosis or not. This is what a typical rheumatoid arthritis hand looks like if they are inadequately treated, or if they leave it for too long with that chronic inflammation. So if you can see why these people will have a bit difficulty, using as their daily activities with some deformities already happen in their hand joints. And just a very brief overview about what happens in rheumatoid arthritis and osteoarthritis. If you can see the middle your left side picture, which is a healthy joint, you can see the bone. This is part of the knee looking sideways. So if you can see that knee of the healthy joint looks very nice and clean. You can see that osteoarthritis joint, you have that damage around the bone. And when you see rheumatoid arthritis, there's damage and there is inflammation. Obviously, with these patients, they will have some pain as well. So that's all the slides and pictures I would like to share with everyone.
Thanks, Prof. Okay, now time to take on questions. So if you have questions for either JC or Prof, please put them in now. So we'll start off with the first question by Malati. So Malati asks, "Hi doc, how effective is glucosamine with chondroitin for cartilage health in knees?"
Yeah, Malati, thanks for the question. Now, this is a question on osteoarthritis. So glucosamine and is something that we use as a supplement in osteoarthritis. So there have been a bit of a controversial with regards to the use of this and osteoarthritis. Some people might find it useful. Some people might not find any benefit, and most of everyone will call glucosamine as more or less supplements. But to me personally, I think if these supplements actually do help you with your symptoms, then the side effects isn't quite significant. I would recommend just to use it. It might give you a bit of relief in some form, because at the moment in osteoarthritis, there's really no significant treatment or drug which can actually completely resolve the pain people have with osteoarthritis. But the glucosamine can be a bit expensive per month, if I'm not mistaken. So, I mean, if you can't afford it, then you can try it. I don't see any problem with it. But if it is a bit of a hassle, the main thing would be physiotherapy, specific physiotherapy for the knees or the joints affected by osteoarthritis, and also pain control. And weight management is also important in osteoarthritis as well.
Okay, thanks a lot, Prof. And Wendy, my friend, asked, she would like to know more about Sjogren, Sjogren.
Yeah, I know someone will ask about the question. So, Sjogren's, how it's pronounced, it's actually a syndrome. People with rheumatoid arthritis can develop this as a secondary syndrome. So, which means that rheumatoid arthritis, and then they develop this Sjogren syndrome. So, Sjogren syndrome is a collection of I would say symptoms or features. So in Sjogren syndrome, people will have dry eyes, significantly dry eyes. They can also have dry mouth. Some might have both together. So the treatment per se is usually symptomatic. So eye drops, mouth spray, mouth gel, just makes it moisten. There are Sjogren syndrome, which can also affect, apart from the dry eyes and dry mouth, but people who have these symptoms, dry eyes, dry mouth, and also their joints, their skin, every other organs affected, I would recommend you maybe just see a doctor and then just get it checked out, actually.
Okay. So, Wendy, I hope that answered your question. And Mr. Lim asked, Prof, what is the cause of tightening of knuckles at certain times? Is it a symptom of arthritis?
Tightening of knuckles. So it depends how Mr. Lim would consider tightening of knuckles, because excuse me. So tightening, if I get what Mr. Lim's question is whether the stiffness you get over your fingers, your knuckles. Now, inflammation, that stiffness people get, or the tightening of the fingers they get, is usually a bit early in the morning, because when people don't move their joints, that inflammation symptom starts to set in. If that someone has that tightening of the knuckles usually late in the evening, and after they do some certain activities, maybe they use their computer, they type 8 hours a day, every day, it's going to cause some strain to the hands, to the joints of the fingers, to the ligaments, the tendons. That's more of like what we call a mechanical rather than inflammatory type of tightening. Usually they might not need that what we call special treatment for rheumatoid arthritis. They will need maybe some ways of occupational therapy, special exercises, and some ways to actually reduce that trigger which caused the tightening of the knuckles. So I hope that answers the question.
Okay, thanks, Prof. And Madam Yo asked, is frozen shoulders a form of arthritis?
Frozen shoulder, I would say so. I would say generally yes, but it's only affecting one shoulder. It's usually related to mechanical rather than inflammation. And frozen shoulder, if someone gets it properly treated with physiotherapy, pain control, adequate medications such as the painkillers and symptom relief medications, then you will usually go away in about a few weeks or a couple of months. So it's it's a, I would say it's a type of joint problem, but not specifically an inflammation type of arthritis. It's because of the structures around the shoulder rather than the joint itself. So,
Okay. Thanks a lot, Prof. I think for Viramani, she asked whether early treatment can do away with the conditions. I would assume that would be a yes.
yes, exactly. The earlier we treat, the better outcome we will get. Because if we treat them late, that that damage will have to start setting in, and when that damage starts, it's really difficult to reverse it back. And even research have shown that people, for example, ankylosing spondylitis, you start treatment early, they might have better prognosis than leaving it a bit too late. So.
I agree. With any diseases.
Of course, yeah.
Um, so Donovan asked, I think this is, you don't have to answer this, Prof, but he asked, have you actually seen insurance cover the biologics treatment in terms of expenses?
Yes, so interesting question. And I don't know whether it's politically right for me to say this, but there are many different types of insurance. I can't just say for one insurance itself, but there have been, people have been trying to put claims for biologics type being infused, I mean, giving through the drip at our daycare clinic. So what these patients go is that they come in the morning, they go in the evening as the daycare session, and depends on the insurance. I don't know. I'm not in an insurance agent, but I have seen some people trying to get some coverage for it. But
Okay.
I mean, the best person is, if you think that is an issue, please speak to your insurance agent. They are really great in helping you out and see what the best coverage or what the best aspect they can help you out. So speak to your insurance agent. It's the best thing.
Yeah, I agree. So Ellen asks, what if the biologics is no longer effective? She has been on Cosentyx for almost 2 years. What would be the other alternative besides physiotherapy?
Yeah, so Aileen, if you might not know, we have a lot of new biologics coming out, and we even have difficulties pronouncing the names because there's so many of them. And research are also increasing in the number of biologics. So let's say if one biologic doesn't work, there's always the option of switching a biologic. Um, Switching to either some biologic in a different mode of action or another biologic which is the same class, um, but it's also indicated to treat that condition. So if you think that that specific biologic medication you are receiving is not working, I would suggest maybe just be honestful to your doctor. Just tell that doctor that, doctor, this medication isn't really doing any good for me anymore. Is there any other medications which might be suitable? Although there might be one of the clause that if we change it too soon, let's say we think it's not if that effective. I mean, there is some improvement, but not much improvement. Then I think it's based on the judgment of your doctor whether he or she would recommend you to switch or not. Because we don't know. Switching another to another medication might help, or it might not help with that specific condition as well. So, but I would suggest speak to your rheumatologist about it and be honest about it.
All right, thanks, Prof. We have a few more questions. JC, we have a question for you as well. So do stay tuned. Abdul Saili, I think he's your patient. He said that he was diagnosed with spondylitis last week and by opto with cataract, both eyes at the age of 45. So the opto suspect it is due, ophthalmologist, I'm guessing, suspected it was due to inflammation. So he asked whether it's related to spondylitis arthritis.
Sorry, Maisie, what specific eye condition he mentioned?
He had cataract in both eyes. Is it
Oh, okay.
connected to?
Yeah. So, yeah, good question, because we know that inflammatory arthritis can also affect the eyes, but cataract is something that we also see in people without inflammation without inflammatory condition, without inflammatory arthritis. So it also is quite common in the, maybe more common in the elderly. And usually cataract, it's when we see patients with cataract, it's usually related to the medications they were on, i.e. the steroids. Or sometimes people will take unlicensed medications, which may also contain steroids. I don't know, but that cataract is usually related to the prednisolone, the steroid medication that they use. They might be associated either with the medications, or although the use of steroids is important because it's one of those important medications we need to use to treat that inflammation, because other medications, they don't work as fast as steroids. So I presume it's probably one of the indication. Possibly either the effect of the steroids, or it could just be something incidental, which he might have had anyway. So
Okay.
I really can't say, but it probably
Yeah.
could be either one.
But thanks for your answer. Kamtian asks, he's not sure whether this is relevant. So he has cracking sounds of point at the knees, ankles, arms, shoulders, and even while he's swallowing water. He asks, is that normal?
While swallowing water, that's quite an interesting symptom. Usually the creaking will be more like mechanical, because when you're, it's not inflammation type. I don't think I've seen anyone, let's say they drink water and develop creaking sounds, but we do see these creaking joints in patients with osteoarthritis. It's quite common, but I would suggest maybe if you do have other symptoms, which I mentioned just now, please go have
Get it checked.
Yeah, that's right.
Yeah. I hope that you get it checked, Kamtian. And now I think Chitra and Michelle Chong, they both have the similar question, so I'll loop it into one. I think Chitra has a question on both of them have a question on COVID vaccine, whether it actually triggers a bad flare for the autoimmune. I think more for AstraZeneca.
Yes, so I've been waiting for someone to asking me about this COVID vaccine questions, because I know it's going to pop up. So thanks for asking. The COVID vaccine in inflammatory arthritis, or in rheumatoid arthritis or autoimmune condition, this COVID vaccine, I would recommend all my patients to get vaccinated, because this COVID vaccine will give at least some protection rather than no protection. And I've seen people with COVID-19 not doing very well. They get really bad. People with side effects, maybe side effects of that COVID vaccine, it usually won't be very long lasting. Most people will just have one day of symptom. It will go away. I would recommend everyone to get the COVID vaccine, no matter which vaccine available, as long as there is some protection. In terms of Pfizer, AstraZeneca, the efficacy, what we call effectiveness of this vaccine is actually quite good. The only thing, let's say people with rheumatoid arthritis, we recommend people who are on a medication called methotrexate to just skip your methotrexate for 1 week if you are going for the vaccine, not because the vaccine causes a side effect. It's because we want to make sure that the vaccine works really well, so that we just stop your methotrexate for 1 week, make sure that vaccine works as much as possible. And that's the reason why people with autoimmune disease, are recommended to see a doctor if you're going for the vaccine. But in general, I would suggest everyone go get your vaccine, go register as soon as possible. And we've seen about the case numbers today, it's over 10,000. So whatever it is, just get your vaccine.
Road to 10K.
Yeah, so we made it today, unfortunately.
So Michelle Chong, I know you asked whether RA patients can take AstraZeneca, and Prof. Fariz answered that. Please take it if you have the appointment, go for it. Just stop taking the drug that Prof. Fariz mentioned for that 1 week, so the vaccine can be efficient and productive in your body. So remember that. And more importantly, just get the letter from your doctor before you head for the vaccine. Now, JC, we have a question from Howie for you. She says, thank you for being vulnerable and sharing awareness. So if you don't mind me asking, does AS affect your sleep? And what was your first reaction when you heard of this diagnosis? How do you overcome or practice mindfulness in embracing this?
Mm, well, personally, for me, it doesn't quite affect my sleep. I'm quite okay. It's only when I get up that there will be pain in my leg and then sometimes in my lower back as well as my neck. So going into sleep is not a problem for me. Getting out of bed is a little bit of a challenge for me personally. And of course, stretching does help. And when I was first diagnosed, um, well, I think most of my peer patients, the people that I get in touch with in our support group, we all share the same thing. When we first get diagnosed, we were like, what is this ankylosing spondylitis? We can hardly even pronounce it. Um, what I can say is that I always encourage new patients as soon as you get diagnosed, there are two things that we should really look at. Number one is to get as much medical attention that you can. Go speak to more doctors, speak to more specialists, and find that one specialist or two specialists who can really work with you because AS is a chronic condition. It's a lifelong condition. You need somebody there to care for you in the long run, and you must also participate in the management of this AS. So for me, I I basically when I was diagnosed, the first thing that came to me is what is this AS about, and what are my options for treatment? What is this AS all about? I want to know. I want to find out as much as I can. And then secondly, after seeing doctors, there are so many support groups out there right now on the internet, on Facebook. Doesn't matter if it's AS or any other sickness, any other condition. Just there are so many other people who has gone through it, and we can really learn so much. I actually learned so much from other patients that I got in touch through the support group, also initiated by Prof. Fariz. And sometimes it's so difficult for us to relate it to even our family and friends who doesn't have those symptoms, who doesn't have this sickness. But it's very encouraging when we get to meet other people who has the same thing with us, and we can really learn from them, share our experience, and just being supportive of each other. Yeah, so that's how I took it.
I completely agree, JC. Support groups are really, really important. I run a young cancer survivors group and we give each other a lot of support. I'm glad you found that group of people to help you. And thanks, Prof. Fariz, for arranging it for everyone, for all the AS patients. Thanks also for sharing, like what Hao E mentioned. I hope that answered your question, Hao E. And if you're going through one of the arthritis mentioned, maybe you can reach out to JC to join his support group as well. And Prof, do you mind? I know we're past time already, but there are so many questions. Do you mind taking two more questions?
Go ahead. No, I don't mind at all.
Okay, so Nara asks, does osteoarthritis goes off on its own because she had few months of stiff fingers in the morning, but then now there's no more symptoms. Does it go off, or she never had osteoarthritis?
Yeah, so usually the stiffness in the mornings at the joints for osteoarthritis usually happens in the end of the day. So after you're doing a lot of hard work throughout the day, and the evening time, that joint stiffness and joint pain starts. So whether the joint stiffness starts earlier, it doesn't sound the typical of osteoarthritis, but people with osteoarthritis in general, the main thing is about pain control, symptom management. It doesn't really change. That joint damage with osteoarthritis doesn't really change a lot, but it's important is what the symptoms related to the osteoarthritis, and that's more important, and how well it's controlled. So I think answering the question, if you still have that joint pain starts again in the morning, maybe just go and see a doctor, get your self checked and assessed would be my
All right.
suggestion. Yeah.
Thanks a lot, Prof. Kenya asks, she has psoriatic arthritis. So people who may have this condition, they might not even be aware of it. So if left untreated, what will happen? Will it be, and is it hereditary?
A good question about psoriatic arthritis. It's in inflammatory arthritis, if we don't really treat it adequately or early, there might be damage, as I mentioned before. So in terms of psoriatic arthritis, if you start having symptoms at the early stage, please go seek treatment. There are treatments available for it. Because psoriatic arthritis, it doesn't just affect the skin and joints. It can also affect the eyes, like JC mentioned, uveitis. It can also affect the spine at the back, sacroiliitis, the sacroiliac joints at the back can be affected with psoriatic arthritis. It can affect the nails, not very cosmetically good, for example, for supermodels with the disfigured nail. So it depends, but it depends on the situation, but get itself treated early. Genetic wise, there are some genetic predispositions and some genetic links in terms of psoriatic arthritis. We don't have a specific genetic test that will confirm this patient has psoriatic arthritis. Generally, you won't pass it on to your children, but if you have psoriatic arthritis, there's just a slightly higher risk for you to have it in the family. But it doesn't mean that any one of your family members will develop psoriatic arthritis.
Okay.
Yeah.
You answered that question perfectly. Thanks, Prof. Sorry, one last question. So, Miss Salvani, she has pain in her knees and wrists after cancer treatment. Is that normal?
Yes. So it depends on the cancer. With cancer, there are many different types of cancer treatment. For example, people with lung cancer, after specific chemotherapy, they will have that non-specific joint pain, whether it's the hands, wrists, or knees. After a while, when they stop that chemotherapy, these symptoms will tend to go away. Usually, all these joint pain related to after chemotherapy or during chemotherapy, it's usually related to the chemotherapy drug itself. But obviously, with the chemotherapy drug, it's very important that you adhere to it. If you have just slight joint pains, which doesn't affect your activity, there's no really swelling around it, obviously the benefit was still for you to continue that chemotherapy, or once you complete that chemotherapy, that joint pain will usually go away after a few weeks.
Okay. Thanks a lot, Prof. Sorry for this. We have so many questions. Like everyone's so interested in today's topic, and thank you so much all for your questions. Thank you so much, Prof, for answering everyone's questions today, and JC as well. Thank you both for joining us today. Time is up. We have actually covered one whole hour already, and I would like to thank you again. If you have questions for Prof or JC, you can actually pass it on to me. I'll try to ask them. And if you want to join AS support group, maybe connect with JC, or I'll ask Prof for more details as well. Thank you so much, everyone, for tuning in today. Next month, we're going to talk about fertility. So stay tuned to the page. Find out more through postings that I will be announcing either on a Friday or a Saturday. So I'll see you guys very, very soon. Stay home, stay safe. And thank you once again, Prof. Fariz and JC. Have a great day, everyone. Take care. Bye.
Bye.
Bye.